My name is Shelley Flax. I'm a licensed clinical social worker at Illini Community Hospital in Pittsfield, Illinois. Today I am going to teach you about EFT, which stands for Emotional Freedom Technique. I am a certified practitioner of EFT, and I am certified out of EFT International in the United Kingdom. A little history about EFT. I told you it stands for Emotional Freedom Technique. It's a proven alternative method to reduce and resolve stress, anxiety, phobias, emotional disorders, chronic pain, weight control, and limiting beliefs. Tapping consists of using our fingers on specific acupressure meridian points on the body to balance our emotions and our nervous system and restore the body's balance and energy. The history of tapping is from the ancient Chinese medicine with the development of acupuncture. And Roger Callahan in 1979 founded EFT. And through this, Dr. Callahan discovered that a person focuses on specific fears at the time they are tapping, they can reduce or eliminate those beliefs and fears and phobias. So I have an individual here that I was going to demonstrate on and show you how EFT works. So, Melissa, do you want to tell me what is going on with you today?
Anxiety.
Where do you feel that at?
I chew my nails.
Okay, and how would you, is there a certain time you notice that you do that?
When I'm anxious or nervous.
So is it, when you feel anxiety, do you feel it anywhere in your body other than just chewing on your nails?
My mouth and, my fingers.
So just that chewing sensation, that desire to chew on your nails and, okay. And you don't feel it anywhere else in your body? Is there a certain place or event that triggers your anxiety that you're noticing?
Nothing particular.
So just, it can kind of just come and go?
Yes.
Anxiety? Just different events?
Yes.
So if I were to ask you if you notice it more at work or at home, where would you say?
Probably at home.
Okay. And do you ever notice it if you're doing something or an interaction, or if you're alone, or if you're with other people? When do you notice it most?
If there's something, that going on that, makes me a little nervous.
Okay, so there's something triggers it when maybe there's other people around?
Maybe.
Sounds like? Okay.
Yeah.
Okay, so, but you're noticing that you chew a lot on your fingers when you're nervous?
Yes.
So what would you like to do with this?
I would like to be able to not chew on my fingers.
Okay. So how would
My
you...
nails.
Okay. So how would you rate that on a scale of 1 to 5, or 0 to 5? 5 being the worst, like where do you feel like your anxiety's at?
Probably at a 3.
Right now, you'd say it's at a 3? Okay.
Yeah.
So we're gonna do a setup statement, and then I will start the setup statement, and you will repeat after me. When I pause, you will start, but I'm going to walk through and show you how to do tapping.
Okay.
So we start out on sleight of hand.
Okay.
You can do this with me. And we just tap like this, or you can use your fingertips.
Okay.
And we'll do the setup statement, and we do it 3 times.
Okay.
Then we will walk through, and if you want to move up to your top of your head, we'll take our fingers and gently tap on top of our head.
Okay.
And after we do those setup statements. So we're going to keep talking while we do this about the things that you just shared with me. And then we're going to go into the beginning of the eyebrow. and tap
Okay.
in there. And you want to use 2 fingers, and you want to be able to move some energy.
Okay.
And then go to the side of your eye,
Okay.
and then we go under the eye. And again, as we're tapping, we're going to talk about those events that you just shared with me
Okay.
as we're doing this. This one here would go underneath your nose.
Okay.
So right above your lip, in between your nose and your lip.
Okay.
And then this one is on your chin, in between your lip and your chin.
Okay.
And then this one is the collarbone point. And we take 2 fingers and
Okay.
you spread them over the collarbone and you tap on that.
Okay.
And then we go under the arm, and this is called patting the baby.
Okay.
And then we go directly on that bottom rib
Okay.
center and tap in there.
Okay.
And then back up to collarbone.
Okay.
And then the last, we're gonna do our fingers. So you're gonna
Okay.
take either hand, whichever you're comfortable with,
Okay.
take 2 fingers, and then tap on the outside of your nota.
Okay.
And then we're gonna go to the next one. And then the middle finger. And then from the middle finger, we're gonna slide it under. And the reason we slide it under is because the meridian point for this finger runs down the side of our hand on the side of our finger. Where
Okay.
the other meridian points are on this side of the hand.
Okay.
And then we go back to side of hand.
Okay.
And then we pause and what we call checking in or kicking the tires.
Mhm.
So I would check in with you and ask you those symptoms that you shared with me, how do you feel about them? So the whole time I'll be just repeating back those things you said to me and that statement. And then you can tell me at the end, when we check in, we're gonna reevaluate where you feel about your anxiety.
Okay.
How does that sound?
Good. Thank
Is it-
you.
Do you understand all the points that we talked about?
Yes.
So if you think about your face, it's a question mark. When you start at the eyebrow, we
Mhm.
go around and it comes straight down,
Okay.
like a question mark.
Go around
And then straight down.
Okay.
So start here, corner of eye, under eye. So it comes out to be a question mark on
Okay.
your face. So, so we can do the setup statement. Are you ready? So even though
Even though
this anxiety,
this anxiety,
I chew my nails.
I chew my nails.
I notice it when I'm anxious,
I notice it when I'm anxious.
and I'd like to let this go,
And I like to let this go.
and I accept my feelings.
And I accept my feelings.
Even though
Even though
this anxiety,
this anxiety,
I notice I chew my nails,
I notice I chew my nails.
and I'd like to let this go,
And I like to let this go.
and I accept my feelings about it.
And I accept my feelings about it.
Even though
Even though
this anxiety,
this anxiety,
I notice I chew my nails
I notice I chew my nails.
when I get anxious,
When I get anxious.
and I like to let this go,
And I like to let this go.
and I accept my feelings about it.
And I accept my feelings about it.
So we're gonna go top ahead. This anxiety,
This anxiety,
I notice I chew my nails
I notice I chew my nails.
when I get anxious.
When I get anxious,
I catch myself doing that,
I catch myself doing that,
chewing my nails
chewing my nails.
when I get anxious.
When I get anxious,
I notice I chew my nails
I notice I chew my nails.
when I become anxious.
When I become anxious,
Even when I'm alone
even when I'm alone
or with somebody.
or with somebody,
I can be chewing my nails.
I can be chewing my nails.
I do this when I get anxious.
I do this when I get anxious,
Chewing my nails.
chewing my nails.
Even when I'm alone.
Even when I'm alone.
There's no certain time.
There's no certain time,
Just whenever something triggers my anxiety,
just when something triggers my anxiety,
I start chewing my nails.
I start chewing my nails.
Even when I'm alone.
Even when I'm alone,
This anxiety,
this anxiety,
chewing my nails.
chewing my nails.
Okay. So we're going to take a step, we're going to stop, and we're going to check in. So we're going to take a deep breath, and we're going to hold it. In through the nose, and then blow it out slowly through the mouth. So we're going to check back in. You said before we started, you said your anxiety was at a 3, correct?
Mm-hmm.
And you said that you have anxiety when you could be alone or with somebody, just whenever something triggers your anxiety, and you notice you immediately notice that you start chewing your nails.
Mm-hmm.
Tell me right now, how do you feel like your anxiety feels right now?
I'm more relaxed.
How would you rate it?
Probably a 1.
1.
Mm-hmm.
So did you have any thoughts different about chewing your nails, or did anything come up about that?
Mm-mm. No.
So as I demonstrated with Militia, we were able to bring her anxiety from a 3 to a 1. And so we could continue on with this, but we're doing this for demonstration purposes. So if she was telling me that her anxiety was still there, or something else came up during this time, we could continue on with a new feeling, or if it shifted for her. So what we're going to offer you is a card, and you can go through all these steps. You don't have to do everything exactly how I done it. If you're feeling an emotion, even something that you can't even identify, you can use these same techniques and do it by yourself. You just start out on the side of hand and walk through all the steps. And we are going to give you a card that's going to walk you through every one of the steps that you can do by yourself. And you can also use this video to see how we were using those steps and how to self-soothe when you have any big emotions, or even if little emotions, or you wake up and you feel out of sorts, and you can tap for yourself. I always want to say that for teachers, when we've done this, when I've worked with teachers in the past, they were able to incorporate this in their classroom as well. If the classroom became unruly for some reason, teachers can, I know a lot of teachers just started using tapping on the side of their hand and asked the kids to tap along with them. And when they did this, the classroom was able to calm down and center and refocus. So it's something that you can use to incorporate in your classroom as well, by just using simple sleight of hand or tapping around on the fingers. And I do want to say one thing. What we do when we get anxious, we want to wring our hands. And so the hands are the focus of anxiety. And so if you want to teach this to your students, and you know that there's people that are anxious that may not be able to exactly follow the steps that we did with the tapping on the fingers, they can just hold the fingers on each side and squeeze and breathe. So you take a breath in, hold it, and blow out. And you do this for each finger. And so that way the kids don't need to know how to tap on each side of the hand. But you can incorporate this in your classroom as well, and to regulate and calm your class.